Hello, my name is Dr. Lizzie Burns, and I've recorded a few films already, which I hope you'll explore. I have been introducing origami as a beautiful thing you can do at home that's a little bit of science, it's engineering, at the same time it's also art. And once you get playing around with a piece of paper, you'll find the possibilities are endless. And there are many people around the world who are visually impaired who do origami. And I hope that you'll watch a film where I've interviewed Yuen Ha, who is someone I met at the British Origami Society. She trained as an engineer. She's visually impaired and has been so since she's been a child. And she has just such an amazing positive attitude that you can do so much. And she does amazing origami. She's been inventing things herself. So I've recorded a few films to be able to encourage you to get folding. I'm trying to describe a bit more than I normally do, so I'm doing my best to try to encourage you and just enjoy it most of all. But this film is another special edition for your science fair because thanks to the Royal College of Pathologists, I am here with a medical doctor, Dr. Esther Youd, who has come along and she's going to help introduce a really interesting subject. I'm going to ask her questions and we're also going to do another piece of origami. We've collaborated before together and we've come up with an activity which I hope you'll enjoy to make your own origami beating heart, which does move and it does make a sound as well. I don't know if you can hear that too. So it's a little piece of engineering. Esther, what's a pathologist? Oh, I've realised you're muted there. There you go.
A pathologist is a doctor who, in fact, there's lots of different types of pathologists. I'm a histopathologist, which means I look down a microscope at pieces of tissue from patients and try to make a diagnosis. And I also do post-mortem examinations to try to find out why somebody dies.
Thank you. And you were saying about these different areas of pathology. So there'd be scientists or doctors who study disease, what can go wrong, and help work out why someone's unwell and help get them better, or look at them after tissue after they've died. And you were saying that different areas of pathology involve more vision. So your area, you were saying with microscopy, looking down the microscope is quite visual, but there are other areas which maybe are more suitable as well.
Yeah, there are lots of different pathologists. Pathologists deal with infections, like microbiologists. They deal with blood samples in a laboratory, and they deal with tissue like me. And so there's lots of different possible careers in pathology for people that are interested in science and medicine.
Thank you. And science is all about understanding things, isn't it? And it often is so physical as well. How do things work? Asking questions and helping people. And I guess, well, how do you become a pathologist? I guess it's a long
So
story.
it's quite a long trip. So you need to do science A levels at school, first of all, usually biology and chemistry. And then you go to university to study medicine to become a doctor. And then after that, you can train as a pathologist. So the whole process takes 10 years or more from leaving school, but it's really worth it in the end. It's a great career to have.
Oh, thank you. And you specialised, is that right, in the heart? Is that what you specialised in? Or many
Heart is one
different?
of my areas of interest, yes.
Oh.
Because I do postmortems to find out why people die, the heart is quite often involved with why people die. And that might be from common diseases like furring up of the arteries, causing heart attacks, or it might be from uncommon diseases that might be inheritable in a family. And so it's an area of interest of mine because it does cause sudden death, but also because it's so important to identify those diseases that can be passed on within a family and hopefully save a person's life in the family in the future.
Oh, it must be a bit like being a detective.
Definitely,
Kind of
yes.
crack a problem and then hopefully help other people. Yeah, well, thank you for the work that you're doing for everybody. Everybody in the NHS is helping so much. I think we're so aware of that at the moment, which is a really good thing. Particularly pathologists are behind the scenes, aren't they? So it's really good to meet one. So it's quite unusual for you to be able to meet a pathologist. So you may print out a sheet, or I'm going to explain how to do this just from any A4. But just to explain, the activity that we originally did is to fold a heart. And actually what I've done is I've done some drawings to show how your heart looks like under the microscope. And on one side normal, and on the other side changes that can happen with disease, and that's the kind of thing that Esther looks at. So the kind of how what are these as a heart beats? I mean, is it down to the cells? Are you able to say, Esther, about the normal cells?
Yeah, the heart cells are really unique in the body. They're a type of muscle, but they're a muscle that is different from all the other types of muscle you have in the body. It's a very specialized muscle, and the individual heart cells connect up with each other. So actually, you can identify them by the big blob, which is the nucleus in the middle of a cell that separates one cell from another, but you can't see the edges of the cells because actually they sort of merge with each other. And that's fairly unique as that part of the heart muscle. And the muscle cells send electricity between each other and cause a contraction of the muscle, and that causes the heart to beat.
Amazing. So we're going to try to make our own beating heart. So yeah, so from the front, this heart looks kind of like a heart. It's a little bit straight lines at the sides, but it's a little bit curved. But on the back, this is where we see the inner workings of our origami heart. And there's a little handle which you can kind of pinch and hold on to. And as you squeeze it, it moves the flaps of the heart, and it makes a lovely sound as well. This comes from an origamist called David Petty, and it's actually a legacy because he has passed away, and how lovely that he invented something and passed this on. So what an amazing thing to fold a beating heart. So I reckon we could slowly get going on this, and I will ask Esther some more questions maybe as we go along as well. So get yourself a piece of paper. It may be the sheet, and it's fine if it's not. I'm going to show you from a blank piece of paper. So I have got here an A4 piece of paper, and I'm holding it in the landscape position. So it's kind of the long side is at the bottom, and the shorter side is going up at the side. So it's kind of a landscape position rather than vertical. Right, I'm going to direct my camera down, and it's a bit unusual. Most origami, you make squares, and I've done a little film to show you how to make a square. In this case, we're going to make a strip, actually. So the strip will be the dimensions of 3 by 1 in proportions. So your piece of paper, your A4 paper, one side it's 21 centimeters, the other side it's around 30. We want to go for the shorter side, the side of the landscape, the shorter side, which is 21 centimeters. And we're going to cut off a strip that's just 7 centimeters. So you could, I don't know whether you could measure that, or else if you think about the proportions, think about the length, the height of this strip as 3, and this needs to be a third. So it's quite a strip. I'm going to fold that down. So if you fold over at 7 centimeters, make this strip. Put down a bit more. Thanks, Esther. You're being very patient. You've made a heart before, and remember, it beated very well. Beated? That's not quite the right word. So I'm folding along 7 centimeters, and I've lined up the sides because that's the way I know it's all straight. Now you could either cut off, you can hopefully feel that line where you folded it, or you can tear it. I tend to tear, but you do need to make sure that you keep everything nice and flat on the board. So I'm going to do a tiny little nick at one end, and then I should be able to tear off a strip. But you do need to keep your hand quite close to that line. And with origami, it's good actually to do really good strong folds because it actually gives it the strength. Everything goes well. If it's a soft fold, you don't really know where the line is and things just don't work well. So don't be afraid to put in that strength, make really nice folds. So hopefully you've got a long strip of paper. And if you have it, so again, it's in a landscape position. So the longer side is at the bottom and the sides are shorter. So it should be 3 by 1 in proportion. So our first step is we're going to fold it in half, which is half of the long strip. So, oh, I'm so not used to putting things into words so much, but I know it's so important. So as it's the long strip at the bottom, I'm going to fold it in half vertically. So yeah, I'm going to give it a go. So when it's folded in half, it's often called either a mountain fold or a valley fold. A valley means it goes in and a mountain means it pops up. So that's what's called a little valley fold. So it's folded in half vertically as this is lengthwise. Okay, I hope this is working for you. Also, actually, UNHAR suggested it's always good to do it with others. So hopefully you may be at home with your family and then they will also join in. And then it's also a kind of a, you're doing it together. So it becomes a lovely memory and experience as you all try to figure out what on earth I mean. So we're going to take a side, the bottom side, that long side, and we're going to fold it up to that middle line. So it's lifting up to go vertically. There we go. And I'm going to do the same on the other side. So from that midway line, the side I'm going to lift up, which is the longer side at the bottom. And I'm going to lift it up so it goes vertical along that midway line that you folded. And lining it all up. So Esther, I guess the heart is a mechanical thing, isn't it, really? I don't know. In a way, it feels quite appropriate, doesn't it, origami, that it's all about engineering and forces.
Yeah,
And
that's
it
a
has
really
to
good
work
point.
all the time.
Yeah,
Yeah.
and it goes all the time, and it keeps going without you even thinking about it. You can't control how fast your heart goes. It just keeps going, and it responds to all the different demands that you place on it. So if you go for a run, then it will beat harder, and if you sit down and relax, it will beat slower. And actually, if you take the heart out of somebody, it carries on beating outside the heart,
Wow.
outside the body as well. It's really incredible.
Gosh, that's amazing. And at these times, I don't know about you, but these are quite anxious times. I do feel a lot more aware of my heart beating, actually. Is that just kind of nervousness? Is there stuff that you can do? Would it be better if you can calm your heart down? I don't know if you've got any thoughts there on well-being, Esther.
Yeah, that's a very good point. So when you do get anxious, you can become more aware of your heartbeat. It can beat faster if you become anxious. And if you are able to relax, then you'll slow your heartbeat, won't be aware of it so much anymore. So yes, it's really important. We're all living through difficult times with this pandemic, and it affects our relationships with people. We're not allowed to see people like we used to. We're not allowed to do the things that make us happy so much. So it's really important that we find time to find other things that make us happy, and joy in simple things, and take time to relax and look after ourselves and our heart.
Oh, yeah. Maybe origami, making a beating heart origami is calming your own heart. Yes. So at the moment, hopefully, as you're holding it, it's kind of a V shape at the bottom, and there's a little vertical side. So what I'm going to do now, and it's sort of smooth, so I can feel a halfway line. I'm now going to turn it to the back. And you'll feel that again, it's a V shape, but there's also a kind of horizontal line at the top of that V. And there's a vertical line that runs through it all. So our next step, there's not too many steps, so be kind and persistent, you'll get there. I'm a little bit like the last step. I'm going to take the side, which is at a diagonal angle, and I'm going to take that side just to the bottom, and I'm going to twizzle it around so it lines up through the midway vertical line. Now, I've been really careful. There's at the very back, which you may feel, it's a kind of a whole flat area, and I'm not going to fold that. So I'm just folding the lower V shape. So I'm taking the side and I'm moving it round to that vertical line, and it's forming the front of your heart. There we go. I hope that's working for you. And the same on the other side, that we're taking the diagonal at the bottom, and I'm just moving that area around to meet the vertical line, and it means that both halves meet together. And Esther, you do have these different sides of the heart. Why do you have two sides of the heart?
It's because they do different functions. So the right side of the heart only has to pump blood to the lungs, which are really close to where the heart is. So the heart muscle doesn't have to be so strong just to pump blood just to the lungs. Whereas the left side of the heart needs to pump blood all the way around the whole body. It's receiving the blood with oxygen from the lungs, and then it has to pump that oxygenated blood all the way around the body. So it needs to be a lot bigger. The muscle needs to be thicker in order to really pump hard to reach the far corners of the body.
Mm-hmm. And it all has to be coordinated and going the right direction. You have valves, and it really is a piece of engineering, isn't it? And I guess any trouble and you wouldn't be well very quickly. So it really has got to work very well, hasn't it?
Yeah, and in most people, your heart beats for 70 or 80 years. It beats for 60 times a minute for all of those years. And yes, we're very, very reliant on our heart working well.
Oh, we can all be very thankful for that. Or else we wouldn't be here, really, would we? So we're definitely thankful for that. So hopefully you've got something which would be a little bit like a heart. So it's got this sort of V shape at the bottom, and I guess also diagonal lines at the side. It's a little bit of a sort of sharp heart at the moment. So I always think it's a bit like a square, it's a bit like pixels. Let's soften it. So the very top, you might feel there's a little point. You can fold it back, and it's just tucking away the point, and that will help soften the heart and make it look a bit more like a friendly heart. It's funny how we use hearts so much, isn't it, Esther, for showing feelings. Do you know about that? Is this kind of going back to ancient Greek times, where we believe the heart is about our emotions? I don't know if you know about that.
It's not my area of expertise, but yes, as we tried to understand the body, we obviously recognized that the heart was important and gave it lots of sort of uh, related importance. So yeah, we thought that it was to do with where our soul was or where our emotions were, all those sorts of things. So the heart has always been really important right throughout the years, and we always associate it now with emotional attachment, although the heart really doesn't have anything to do with your emotions. That association still carries on, and it's a symbol well recognized throughout the world.
Yeah, it really is. And actually one that we're using a lot in this time is showing how much we care for each other. I wonder whether it's also about, again, being aware of your emotions. If you're feeling nervous, you notice that, even though, of course, we associate the heart more with love, where you're probably more relaxed. It's interesting, isn't it? Not really thought about it before, but I'm just thinking what a
Yeah,
powerful
well,
symbol it is.
I guess if you're in love, and particularly if it's the first time that you're in love, your heart beats quite quickly, and so it might feel quite fluttery in your chest, as you're so excited. So yeah, that might be a reason why it's so linked.
Oh, how lovely. Yeah, I hope you have some nice fluttery moments at times. So we're just going to soften down those top points. And actually, this is a good one for fluttering as well. And we do need a little bit of excitement too, aren't we? I think that's what we're missing quite a lot of these times. So I've folded down the very top points. There's also side points as well. You may feel there's a sharp bit, in which case you can fold those back. There we go. Right, so hopefully the front face is kind of smooth and it's sort of heart shape, what we think of as heart shape, our nice symbolic image of a heart. So next we're going to turn it round to the back, and there's some interesting structures. You may feel like a sort of almost a kite-like shape, almost like an ice cream cone shape. It's longer at the bottom and there's a flat line there. And we're going to make a little handle there. So feel that sort of cone, the ice cream cone sort of shape. And we're going to take the very top, so above the cone, I suppose it'd be like a pointy ice cream at this point, that pointy diagonal line, we're going to fold to the middle line. And it's a little bit tricky. You're going to have to line up with the middle there if you can through that point. So it's always like to think of like wrapping up or almost closing a little present here. We're taking the sides, and once it's closed there, it feels like a little triangle at the side, and we're going to do the same for the other side. So that top diagonal line of that inside structure, we're going to take from the outside and match it, move it round to that vertical line. Let me see, trying to do this into the camera. I think I might bring the camera down. There we go. And it says, well, if you can get it right through the tip of that point. So hopefully it looks a bit like this, but again, maybe you need some help there. So it's like an ice cream cone, but it's been kind of narrowed off at the top, made less wide. So there should be two flaps at the top. And if you open up those flaps, again, I like to think of opening a present, and feel that midway line, the top of the ice cream cone, and pulling it down, tucking in the sides, and you're trying to make it into a sharp point. So, and what you'll be doing is making a little handle. So what was once that horizontal flat line has now become instead a sharp little point. You have to really play around, but what you've made is a little triangular point that sticks out from the back of the paper. And now if you put your thumb underneath and your fingers at the top and squeeze, hopefully your heart starts to come to life, and it makes a really nice little noise. What's the noise in the heart, Esther? Because that's something that we can all hear, isn't it? What's that about?
Yes, when the blood flows through the heart, it moves through valves, like you mentioned earlier. And the valves open and close. So they open to allow the blood to flow through from one chamber to another, and then they close behind it so that it stops the blood from going backwards in the heart. And it's the closing of the valves that causes a noise, because it disrupts the flow of the blood, and so therefore you get a noise. And you've got two sets of valves, one between the atrium and the ventricle, and the other between the ventricle and the outflow. So either the pulmonary artery or the aorta on the left side. And so those two sets of valves give you two noises as your heart beats. So you get ba-bum, 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 ba-bum as your heart beats.
And it's pushing it round each time in the same direction, so it can't go backwards. Is that right?
Yeah, that's right. Yeah.
Yeah. Oh, well, we really hope that that's worked for you. Hope you've been able to find your very own beating heart. Mine's just sort of coming to life, really. It often takes a little time to get going and have a little play around. And yeah, I hope that's been fun as well, to meet a pathologist and hear about that. And I guess, as Esther was saying, to try to do well at school with science, that there will be many options. And yeah, keep up, most of all, a curious mind. Enjoy learning and asking questions. And we hope it takes you to brilliant places. I'm sure it will. So thank you. And yeah, happy beating hearts. Thank you very much.